Is your menstrual cycle regular? This can be a very difficult question to answer, and recently I got this question on my TikTok which says my cycle is between 34 and 37 days, and just recently I had a 40-day cycle. Is this irregular? And so I thought I'd just dive into this question a little bit more because it seems to be coming up quite frequently. And there's a lot of confusion around how to know whether your period is regular or not. So firstly, let's just quickly recap the menstrual cycle. So there are different phases of the menstrual cycle. The first phase is the follicular phase. And this is really where your ovaries are starting to mature some follicles. So a few follicles inside your ovaries will begin to mature, and then one follicle will start to mature more than the rest. Now, during the follicular phase, estrogen starts to increase, and this rise in estrogen eventually triggers the release of another hormone called the luteinizing hormone. And luteinizing hormone, also known as LH, is what stimulates ovulation to occur. So eventually one of those follicles that has matured more than the rest will burst out of the ovary, and that is called ovulation. And so ovulation occurs around about the middle of the cycle, but this can vary depending on your hormone fluctuations and depending on your individual cycle. And so once that egg has been released from the ovary, behind it, it's leaving the corpus luteum, which is like a crater that forms on the surface of the ovary, and it becomes, or it turns into a gland that starts to produce progesterone. And progesterone really is the hormone that supports the lining of the uterus. It's also known as the pregnancy hormone because if that egg becomes fertilized, then you need high progesterone to make sure that that endometrium stays in place. So progesterone starts to peak at this point, and it reaches its peak around day 21 of your cycle. And then if that egg is not fertilized, then progesterone will begin to crash, and that's actually, that drop of progesterone is actually what causes the lining of the uterus, called the endometrium, to begin to shed. And so typically a normal menstrual cycle is between 21 to 35 days. 21 is a bit on the low side, but there are people who have each and every cycle 21 days, and their period is regular on a 21-day cycle, and so this can be considered normal. 35 days is also pushing the extreme on the other level. So it is a bit of a longer cycle, but typically if you're having your period regularly every 35 days, then this can also be considered normal. Now, how do you know if your period is happening regularly every 35 days, every 21 days? Well, the only way to know is to track your period. Now, this really helps you to be able to determine whether you are having a period around the same amount of days every cycle. And so the first day of your period is day 1 of your cycle. And just to keep it consistent, you can consider day 1 as a full flow before 5 o'clock in the evening. And so if you've had a full flow before 5 o'clock, that's day 1 of your period. And then you'd mark that on a calendar or use a period app. And then after about 3 months or so, you can look back on your tracking and you can be able to count the days in between each day 1. And if those days are pretty consistent, then and they fall between a range of 21 to 35 days, then you can consider your period regular. However, if you are having variation between how many days there are between each day 1 of your cycle, then that is not considered a regular period. But let's go back to the question. This person is actually having a very long menstrual cycle, which is between 34 and 37 days. So certainly 36 days, 37 days between your cycle is not considered normal. And certainly, as they've mentioned, they experienced a 40-day cycle. This gives me the impression that the menstrual cycles are progressively increasing in length. So they're becoming, there's an increasing amount of time steadily between periods. So I would consider this menstrual cycle irregular because firstly, the normal days between the cycle were quite long to begin with, but now there's actually an increase in the amount of days between the periods. And so this would definitely be considered an irregular cycle. So what could be causing this increased length of time between periods? Well, there are a few things to consider. If you are really stressed out, your body is not going to prioritize your menstrual cycle because reproducing is not important when you are under threat. And so stress is a common trigger that negatively affects our menstrual cycle. So if you've been experiencing perhaps a really important life-changing event, or there's something really big that has been causing you a lot of tension, anxiety, stress, then this could be influencing the change in your menstrual cycle. The other things to consider are you eating enough? So there's a condition called hypothalamic amenorrhea, which is where the period completely disappears when you're not eating enough food. So you're not getting enough nutrition. Now, your body is so intelligent, it knows that if you are in a state of starvation, then you shouldn't be reproducing because you need to keep all your reserves to yourself. And so your body shuts down your menstrual cycle in order to make sure that you don't get pregnant and increase the demand on your body. And so not eating enough food can actually trigger a change in your menstrual cycle. And then it's important to consider age, because if you're under the age of 45, then this could actually indicate a condition like polycystic ovarian syndrome, which is one of the most common causes of these long menstrual cycles. Also, if you are ill, your body's priority would be to get you well. And so all your reserves and your resources are going to be focused on making sure that you get better. And again, your body will begin to shut down your reproductive system because it knows that your priority is not reproducing and having babies in this moment. Your priority is actually getting well. And then there's a few considerations if you are over the age of 45. So of course, menopause or perimenopause is a consideration. Menopause really just means that your period has stopped for a duration of 12 months. And so when you're leading up to the menopause, what can start to happen is you can start to see this increasing length of time between each period. And the other consideration is thyroid disease. So diseases of the thyroid can affect the period as well. And so it would be important to get a few tests done just to be able to drill down and find out what could be potentially causing this increased length of menstrual cycles. And there's a few tests that can be done to better clarify what could potentially be causing this. So it would be important, of course, as always, to do a pregnancy test. This is one of the most overlooked tests that are obviously very important in women of childbearing age. But pregnancy test just to give us an idea as to whether changes in the period are as a result of a pregnancy. Then you would want to do your hormone panel, and typically we would want to see the fluctuation or the level of your hormones on day 3 of your cycle. You'd also want to do your insulin level. This is going to be helpful if you're suspecting polycystic ovarian syndrome. A thyroid function panel is also important to make sure that you're ruling out thyroid disease. And then other tests like DHEAS and sex hormone binding globulin, which will also help us better clarify whether this is potentially PCOS. So if you are having an irregular period, then it's very important that you speak to your healthcare provider and find out why, so that you can get to the root cause and fix your period. Thank you so much for tuning in to this episode. Go ahead and watch this video on your screen next, because this is the one that YouTube thinks that you should watch. And if you aren't already, please go ahead and subscribe, and I'll see you in the next episode. Bye.